We're live.
We're live. Hold
Hi,
on.
everyone.
On your feet. Here I come.
Gotta get a better camera.
That's all right.
It is what it is.
Welcome. We are the Bridge Builders of Diversity, and today we will be talking about Cleft Palate and how this all came about. Since we have a pretty low incidence in the United States about Cleft Palate, I was working with somebody and the commercial came on for Project Smile, or one of those organizations that goes and repairs the cleft palate. And my coworker was like very shaken by the whole commercial. It was very upsetting to him that he has a lot of empathy towards that, and he was visibly shaken by it. And I wanted to ask him 20 questions. So he really had to compose himself. So I thought it would be good for us to talk about cleft palate. Kimmy's an ER nurse, so she's going to talk about the medical end of the care and what it medically means to have cleft lip and palate. And Roberta is a special educator, so she's going to talk about the educational needs for children who have cleft palate. So we'll start with Kimmy with the medical part.
Yeah, as Sherry said, I am a nurse. I'm not a doctor. So I'm speaking from knowledge that I was imparted in nursing school, and what I've currently read, of course, in some of my research about today's topic.
Because that's what we do.
Because that's what we do.
So we can bring you information and help bridge the divide.
That's right. So cleft lip palate, they can happen with just the lip or the palate, which is the roof of your mouth. And you can have one side of the lip or both sides. We call that unilateral or bilateral cleft lips, and they can happen together with cleft palate as well. And you can have the hard part, which is the roof of your mouth, and the soft part, which is a little further back, involved as well. And these children have visible deformities, which can be very scary for a new parent. You're expecting this very perfect baby, and the child's born with a deformity. Very scary, very scary. So from a nursing perspective, we love and care for our patients, and we impart our compassion and our knowledge. And we tell them right off the bat, this is a repairable thing. It is a surgical fix, and it will not happen until baby's probably 5-6 months old. And then they may have further surgeries depending on the deformity itself. So the biggest thing is, baby may have a hard time, most likely will have a hard time with sucking. So you can imagine yourself as a new parent trying to breastfeed.
Scary.
Very scary. So it's up to the medical folks to help guide them. And there are special nipples for babies, physical therapy, OT, occupational therapy. Those folks get involved right away to help parents learn how to feed their children. That's one of the things. Feeding is big. They also can have ear infections because the fluids can communicate into that middle ear. And so the baby can't have surgery till it's 5-6 months. You can certainly have infections of that ear. So you have to make sure you stay on top of those things, and they can have hearing loss too. So that needs to be watched over. They also can have, because the soft palate, the hard palate is part of the dental, kids can have issues with teeth. So that's another thing parents need to stay on top of and watch for a proper formation of their teeth. Some of the other things, like I said, surgeries won't happen till about 5-6 months, and then the hard palate.
They can also possibly have a few surgeries.
They could have one or two, right?
And they can go on.
It can go on until they're adolescent, because it's so important with speech.
As your face
and
your
your
head
face,
grows.
right? I mean, kids are we know kids can be cruel,
Right.
And you see it. Kids struggle with this deformity. They sound different, they look different. So good parenting. I get the kids involved right away with speech therapy, things like that. Early intervention. Hand that over to
and that's where I come in. I'm a special education teacher, and right now my focus is 3 to 5 year olds. So when I was doing my research, I actually only read one article, but it was so good because it's an article called Children Cleft Lip and Palate in Early Childhood Classrooms, Overcoming Obstacles and Misconceptions. And it's written by a mom of a child with cleft lip and palate. So some of my main takeaways were, please know that when a child is born with cleft lip and palate, it does not affect their cognitive ability. So their intellect is the same as it would have been without the cleft lip and palate. And like Kimmy alluded to, the anxiety that parents have around just the survival of their infant with this birth defect has long-reaching effects on their parenting styles. They often view their child as fragile and needing of care. There's scary surgeries when they're tiny infants. There's feeding issues. And if you're a mom out there, you know that those early days and months when they're just learning to latch on and suck and they're sleeping a ton, you're constantly worried whether they're getting enough nutrition. So right from the start, the parents of children with cleft lip and palate experience extreme anxiety, and that carries over into their parenting. They're often very lenient and accepting of misbehavior. They often underestimate their independence and their abilities. And the result of that is the children end up being very, very shy and unsure of themselves. They're very reliant on adult attention. Hey, a special guest. We have a special guest.
Hi, buddy.
Come on in.
Hey, Nate.
Come on, say hi to everyone.
Right.
We're
Say
live.
hi.
What do you mean, why?
We're live on YouTube. Come say
Come say
hi.
hello.
What do it?
Okay, you don't have to
You don't
then.
have to. We're talking about some special
Hi, guys.
There you go.
Thank
Say hi to
you.
everyone.
Hi, Dad, my mom, Kara,
No, I'm
Cam.
Roberta.
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 Kara.
Thanks.
You're
And
Karen.
for you
Mom.
parents who have a child who has a
Right.
disfigurement, I have a child
Mom,
who has a very identifiable.
Mom,
Yes.
Yes.
be quiet, okay?
And he tells me to be quiet.
Her,
Wow.
Charlie, Pepper, Chew.
Okay, thanks.
Kanak,
Yeah.
Johina.
John Cena
Who's
and
your
pentatonics.
That's right.
Bye, hello, Kim, happy birthday, Palestine, Kim.
Party time, Kim.
Party time. Party time, Kim.
My birthday
And
was
for
in
you
June.
parents
Palestine,
who-
Mom, Palestine, Kara,
Roberta.
Roberta.
That's okay.
Kura.
Yeah.
Gerda. I love it.
So for you parents who have an infant
Mom, Kim, Kara.
that may
Okay.
be struggling to eat, has very identifiable
What?
Facial differences.
facial differences, like my son has Down syndrome, so he has very
Okay.
identifiable features.
Kim,
And he also
Okay.
is a cardiac baby, so he struggled to eat and breathe and struggled to get those
Ready?
nutrients in until he had his heart surgery.
Kara.
So, very similarities to the same
Okay.
type of issues. But
Okay.
as you can see, he
He's magnificent and a delight and a wonderful interruption. So as I was saying,
Yeah, wait.
I totally forgot what I was saying. Let's be honest. Okay. Children face obstacles in their
Yeah.
development. Their parents face anxiety, and this is going to spill over into their social emotional development. They're going to feel insecure and shy, and they're going to require a lot of adult intervention. So one of the things that parents and teachers and caregivers. So if you're a teacher, a parent, a caregiver out there, this is for you. Focus always on their strengths, their independence, and their abilities. If you're a teacher, or when in your communications with parents, always focus. always focus on the children's abilities, especially in parent in independence. We provide a safe place for children to share and practice their verbal skills, because, like I said, these differences in their lips and their palate, it's going to make speech sounds very, very difficult for them. So they may feel awkward and no, not Nathan. They may feel awkward and shy, so they need lots and lots of opportunities to speak, to practice making those speech sounds. So provide a safe place for them to share with peers, to have conversations, because remember, they are typically developing in their cognitive and their social emotional, so they need those interactions. Another way to help foster independence is to give your child a job around the house. 3 to 5 year olds can do a ton of really helpful things. They can put their laundry away. They can pick up their own toys. They can feed
dog.
pets. Feed the dog. They can feed pets. They can take out the trash. They can do loads and loads of things that are going to boost that confidence. Make them feel involved in their classroom and in their home. And oh God, I love you. So the takeaway, if you're a parent, if you're a teacher, if you're a caregiver, please see any child as a child first.
Person first.
Person absolutely, person first. Focus on their abilities and their strengths and provide opportunities for them to share those strengths and those abilities. And don't forget, love is number one. Love is number one. Love unconditionally. Oh my gosh, I almost forgot. Do not ever tolerate bullying. Terms like birth defect and hair lip, those are very hurtful and not accurate. And we don't ever tolerate bullying. And when there is a slip up, especially with young children, they might say something hurtful without actually understanding the meaning. Those are wonderful opportunities to sit down and discuss what cleft lip and palate means, maybe a little developmentally appropriate education, and some conversations about how words can hurt.
And with all the right interventions, I can speak as a parent with, from the time he was born, he was an early intervention. He started school when he's 3. He's had many interventions along the way. He has PASS and respite workers, and you see the magnificent job that my son is doing today. But it requires an effort on the parents' part and educators and working together as a team.
Absolutely. So, we are bridge builders of diversity.
And don't forget to smash that like button.
Smash that like button.
If you like our content, please share it with your friends. Please help us get out into the YouTube world.
And if there's something that you want to hear about, if you want us to take a little dive into something, sometimes we take really deep dives. If there's something that you want to hear about, if there's something that you want to know more about, we would love to build that bridge for you so that we can have some understanding up there.
Okay.
Thanks so much. We appreciate you.
Bye. Thank you.
much.
Say, love it, right?
That's right. Bye.
Bye-bye.
Bye.
Oh my God, that was the best.
Bye.
That's our best video.